This episode is on postpartum depression, and I begin with a brief narrative of Mrs. B, who has just given birth to a lovely baby boy. The pregnancy and delivery went very well. This is her second baby. On the 6th day after delivery, people around Mrs. B noticed she had become very irritable, getting angry over trivial issues, sometimes crying. She ate very little and lost interest in many things, including the care of her new baby, who Mrs. B would leave unattended to, even while the baby cried continuously. Her relatives could not understand why, at this time of joy over a brand new and beautiful addition to the family, Mrs. B will be feeling this way. Major depression has many faces and forms. Postpartum depression is one of this. That is, it is a type of depression. The difference here is that postpartum depression occurs in the context of pregnancy and childbirth. Postpartum means after birth. It is a common and highly treatable mental disorder that some women might experience after giving birth. It occurs in about 15% of mothers, irrespective of race, ethnicity, social status, or other defining factors. It is quite common for mothers to experience some negative moods during the first week after birth. They may become irritable, getting angry over trivial things, anxious, and cry more easily. They may also feel unduly fatigued. This experience is called baby blues or maternity blues and may occur in up to 50 to 80% of mothers. The exact cause of baby blues is not clear, but it is thought to be due to a combination of factors, including the biochemical changes that a woman experiences in her body during pregnancy and after childbirth, in addition to the stress that comes with taking care of the newborn. Baby blues usually resolve spontaneously within few days and should be over within 2 weeks after delivery, and the woman is fine again. Postpartum blues or baby blues do not interfere with the mother's ability to care for the newborn. However, it can devolve into postpartum depression, especially in women who have experienced depression in the past. In contrast, postpartum depression is a serious condition that may not subside without an appropriate intervention and will interfere significantly with the woman's functioning. As common as it is, many women who experience postpartum depression do not seek the appropriate treatment because they may feel embarrassed about how people will feel, because they are indeed supposed to be very excited about the birth of their baby. If treatment is not sought on time, postpartum depression can take a toll on the baby's well-being. So, what are the pointers that may imply a mother is experiencing postpartum depression? The onset of postpartum depression is usually within the first few weeks after birth, postpartum, but could occur anytime within the first year after childbirth. The symptoms are myriad and broad and varied, but typical ones include things like a host of negative emotions like feeling sad, empty, overwhelmed, anxious, or irritable, crying for no apparent reason, not being able to concentrate on tasks, losing interest in previously pleasurable activities, not interacting with family and friends like usual, which we call social withdrawal. Sometimes there could be sleep disturbances, which may manifest as sleeping too little or even oversleeping. There could also be changes in the appetite, which could manifest as eating too little or overeating. In addition, there could be recurrent physical aches and pains like headaches, back pains, leg pains, which do not respond to analgesics. There could also be feeling like committing suicide and feeling like committing infanticide, that is, killing the baby. The exact cause of postpartum depression remains obscure like many other psychological illnesses, but some factors have been linked with it. They include factors like the hormonal fluctuations that happen in the woman's body. Usually, like 2 days after delivery, the levels of estrogen and progesterone in the woman's body fall sharply from their highest levels during pregnancy. These hormones, which help to sustain pregnancy, also have effect on the neurotransmitter system that regulates mood in the brain. This crash in the level can trigger emotional instability in some women. The presence of other stress factors can also make it more impactful. Although pregnancy, childbirth, and becoming a parent are positive and exciting events, they can be quite stressful, and especially so when other types of stressors are present. For example, when there is financial hardship, job insecurity, and any other stressor for that matter. Research has also shown that the sleep deprivation that new mothers experience when they need to wake up frequently at night to care for the newborn can contribute to developing a postpartum depression. Apart from the hormonal changes and the stress of caring for the newborn, there are other risk factors that may increase the likelihood of having a postpartum depression, such as having a family history of depression or any other mental illness, the presence of poor social support in the woman's life, like a woman who experiences lack of emotional and physical support from her partner, family, friends. This woman has an elevated risk of developing postpartum depression. Also, a past experience of depressive symptoms in previous pregnancy and childbirth. Also, a past experience of a mood disorder outside pregnancy, like bipolar disorder or depression. In addition, the presence of alcohol or other drugs of abuse can also significantly increase the chances of having a postpartum depression after childbirth. Postpartum depression, like I earlier said, is a type of depression, but now occurring in the context of pregnancy and childbirth. The more of those risk factors a woman has, the higher the likelihood of her experiencing postpartum depression. Apart from the risk of physical harm to the child, this disorder also disrupts the mother-baby relationship, which is so important in the early years of a child's life. It is very important and urgent that a mother with postpartum depression obtains treatment immediately, because this disorder causes a significant disruption to the mother-infant relationship. The quality of this relationship forms the basis of an infant's mental representations of self and others, and also determines the emotional, cognitive, self-regulating development and trajectory. Any affectation of this relationship can negatively affect these areas of a child's mental development with lifelong consequences. There are evidence-based treatments available, and they may include things like psychotherapy, especially when the symptoms are mild. For example, research has shown that people who are pessimistically skewed in their thinking are more vulnerable to developing a psychological disorder during times of stress, including postpartum depression. So when this category of women are helped to learn and adopt more salubrious thinking styles, it helps a great deal. Another treatment modality is pharmacotherapy. There are drugs that help symptoms to abate. Although many people may justifiably be worried about passing the drug onto the infant during breastfeeding, there are safer drug options available to avoid this. Some particular antidepressants are very safe choices for breastfeeding mothers. ECT or electroconvulsive therapy is another choice of treatment, and this is usually employed especially when symptoms are severe. Generally, the prognosis, that is the outcome of a promptly treated postpartum depression, is quite good. However, if it is left untreated, the consequences can be dire for the woman and the baby. So in summary, postpartum depression is a medical illness that yields very well to treatment. It is very imperative and a matter of urgency for a woman who has just given birth and is experiencing abnormal emotional or mental functioning to be taken for prompt treatment at the appropriate place. Thank you for listening.